The COVID-19 pandemic now, and Kenya recorded a whopping 1,974 new infections in the last 24 hours, signaling an ever-stubborn curve. Now, the national deaths also rose to 92 in 3 days after 30 more people succumbed to the virus, according to the latest statistics. And in an attempt to shield more Kenyans from the virus, the government has now opened up the exercise to all age groups. Very own Elphas Lagat reports on the latest figures and the growing queues at various vaccination centers.
There is no let-up in the surge in the COVID-19 numbers, with Delta variant, the current dominant variant, being experienced in the country, pushing the numbers high by the day. Ministry of Health daily report showing 1,974 people tested positive for the disease from a sample size of 13,407. The second highest number since the start of the pandemic and the highest in 4 months. This brings total cases in the country to 215,730, with Nairobi recording 700 cases on Wednesday alone. These pushed the positivity rate to 14.7% compared to 14.5% yesterday. Death toll rose to 92 in 3 days, with another 30 deaths reported. The high numbers is picked from the upscaling of the testing across the country. This coming as the government upscaled the mass vaccination exercise. At the Kenyatta National Hospital, KNH, long queues and a flurry of activities. Kenyans from all walks of life here to receive the AstraZeneca vaccine. The target is no longer limited to vulnerable groups and frontline workers. The scope now extended to all adults.
You come and then you queue, then you get injected. So it takes even seconds. It's very, no pain. It's very easy. So I'll get my second dose on after 8 weeks.
Many like Nicholas, who is in his early 20s, say they were initially hesitant to take the vaccines, going by the reservations of their side effects associated with the vaccines earlier in the year.
Nilikuwa na uoga kwa sababu sijafanya research yangu mwenyewe. Sipendi kuambiwa vitu na nichukue tu kila naambiwa. Nilitaka nifanye research nijue niko sawa, ni vaccine gani, kama ni AstraZeneca, ni Johnson's.
When it has rolled out to all, to the general public, above 18 years of age, we are very encouraged. They are coming well, they have taken it seriously.
In Thika Town, Kiambu County, a similar situation witnessed. The residents turned up in numbers to receive the vaccine. More are now convinced that this is the way to prevent severe disease and even COVID-19 related deaths.
Kuna cases kwa vijiji zenye tunajua watu wamegonjeka, familia zenye tunajua. So sahi juu COVID iko with us na watu tunajua, ndio maana I guess watu wameogopa wakakuja kwa wingi.
Watu leo wako wengi zaidi. Nikiestimate ni kama over 1,000. Na laini inaenda vizuri.
The Kenya Medical Practitioners and Dentists Union are, however, urging the government to ensure consistent and enough supply of vaccines to meet the rising demand.
The counties and even the national referral hospitals need to bring out the bed capacity that's required. There need to be isolation units, and then we need to have ICUs, and then the oxygen needs to be there, so that when you are in the hospital working as a healthcare worker, whether you're a doctor or a nurse or a clinical officer, you actually be able to serve the patient, not just seeing patient dying because you do not have the capacity based on lack of the equipment and the oxygens.
The country received a boost of a consignment of 180,000 doses of AstraZeneca vaccine from Greece last week, with the Ministry of Health confident of more vaccines, including Johnson & Johnson, in the coming weeks. As the uptake of vaccines increases countrywide, it's no doubt incumbent on government to increase acquisition of the doses to meet the demand. Elphas Lagat, Citizen TV, at the Kenyatta National Hospital, Nairobi.